Well, a new year, new you. Women's health is under the microscope this morning. 43% of women say that stress and anxiety are main concerns to their personal wellness, according to a new survey from Everyday Health. I want to talk about this right now. Joining us is family medicine doctor Mikhail Varshavski, also known as Dr. Mike. Dr. Mike, good to see you.
Good to see you.
Yeah, I mean, this is important. Were you surprised by this, first of all?
So I think the survey is a great thing that we're doing. Everyday Health did a phenomenal job, not just taking a look at health, but looking at wellness. Why is that important? I'm a doctor of osteopathic medicine. We're holistically trained. That doesn't mean we don't believe in medicines. It doesn't mean we don't believe in surgeries. What it means is we look as a patient as a whole, holistic whole. So that takes into account their lifestyle. It takes into account their worries. What predispositions to diseases do they have? And not only focusing on what issues they have.
So
and this survey did a great job of looking at that.
41% of respondents also said that weight and dress size negatively affect their wellness.
So true.
It's interesting because
I don't doubt that.
I'm in a bad mood, right?
This is why this is interesting, because not only is obesity dangerous to your physical health because it raises risks of cancers, heart disease, and all of that, but then it affects your mental health as well. So what we're seeing is it's really a balance. It's a balance between mental health and physical health. If something goes wrong in your mental health, it starts affecting you in a physical sense. If something goes wrong with your physical health, it also goes around and affects you mentally.
But can I ask you this, though? But it's not necessarily obesity. It's just a woman's perception of herself and kind of an unfair social burden that is put on women versus men. How do you combat that?
So you have to put things into perspective. You have to explain to people when a patient walks into your office what a true healthy person is. It doesn't mean you have to look at Shape magazine or Women's Health magazine and take advice from them what looks healthy. You have to have a conversation with someone you trust, a health professional. And what's interesting is in this survey, they interviewed millennial women, and they found that millennial women are more likely to seek medical advice from their friends and family members than they are from health professionals.
Huh. Or the internet. They all go to the internet, too.
So this is what I do. I hop on social media with my 3.5 million followers, and I try and be their friend. I try and be their family member that's also a doctor that's giving them this advice, the quality advice that they need that doesn't misguide
It's like,
them.
is this skin cancer? Hey, Rachel, does this look
Well,
like this is skin
in this
cancer?
survey, though, one of the biggest stats that stood out is the worry about financial security.
Yes.
I mean, this was by far one of the biggest stats. I think it was some 62% are worrying about their financial security and weekly pay.
Yep. So interesting how it broke down between when you were born. Baby boomers are not as worried about their financial security as millennials. So it shows that as you have financial security as you age, it changes. So millennials, they're younger, they're more worried about their financial future. They see an impact upon their health. That's important to know as a doctor because it tells you where you should look, what conversations you need to be having.
So what you're saying is the Trump economy is good for your health.
No comment on that
all
one.
roads linked to the Trump economy and the Trump tax plan.
He's saying this child tax credit shouldn't go through. Michael Rubio should not hold this up. I'm pretty sure that's what you said, right?
That is not what I said.
So the survey did show that ladies not happy with the state of their personal wellness can also feel stressed. So that's your whole point about mental and physical, this connected dots.
Well, what you said is really important here. Perspective is key here. When you're talking about stress, a lot of people say, well, Dr. Mike, how do I get rid of stress in my life? And that's a common question. You don't need to get rid of stress. You need to change your perception of stress. Make stress your ally. Make stress your friend. Because all stress is doing is preparing you for a difficult moment, raising your heart rate, making your brain fire faster so you can answer questions on television a little quicker.
But
it's not a bad thing.
But it becomes a vicious cycle of where you don't feel well and you don't know what's wrong, autoimmune, whatever it might be, and it raises your stress level, and the stress makes you feel worse, and it becomes this vicious cycle. And I've had a lot of discussions with professional women in high-pressure jobs where they get into this cycle of like, I feel sick, but I don't know what's wrong, and I'm stressed out about it.
But dig in, there's also like endorphins that are released when you work out, which help you with stress. I mean, there's actual physical things.
Is that what we should do when we get stressed out? Go work out?
3 pillars of health, we're going to get them again. Exercise, eating well, and sleeping. I know you love your naps. So.
Also breathing. An immediate thing is just taking a breath and composing yourself and taking a deep breath. I think that's an instantaneous thing to help collect your thoughts.
Prayer, meditation.
People talk about meditation a lot. And meditation doesn't have to be you sitting quietly with your legs crossed on the ground. It has to be just one of these moments where you live in the present, figure out what's going on, figure out why you're stressed.
Take a quiet moment.
Take that quiet moment and understand what's going on. Because once you have an understanding, you remove this vicious cycle. cycle. The vicious cycle of being stressed about being stressed. That's a very bad cycle to fall
into. Being stressed about like illness or just I don't feel good. What's wrong with me?
Yeah.
It's hard to break that.
Of course.
Very hard to break it.
Really good stuff, Dr. Mike. Thank you so much.
Thank you so much.
Mike Varshavski there.